June is National Men's Health Month, and specifically June 12th through the 18th is National Men's Health Week. So I think it's important we discuss men's health. There's a few statistics I think that are important. On average, men die about 3.7 years earlier than women. Men don't go to the doctor very often, and men are nearly twice as likely to die prematurely from diabetes than women. So obviously, we need to talk about men's health during Men's Health Month because I don't think it's talked about enough. A couple critical things is what's really the top men's health issues. Heart disease, mental health, sexual health, and probably the thing that should be talked about the most is prostate health. So we're going to talk a little bit about prevention, and kind of brings us back to some things we talk about all the time. And that's your foundation, that's your core four. And we oftentimes tell patients, really lay your foundation with that really high quality multivitamin. Make sure you take an omega fish oil, address your vitamin D, and I've said it a million times, everybody should take a probiotic. So there's our foundation, and then what do we need to build on? So if somebody's trying to write their blood sugars before they have to face medication, or they're trying to address their cholesterol levels, or they're trying to address their stress levels, we look to add on to that. So, in high stress situations, men can be under a lot of stress. B vitamins are going to be good for us. They're adaptogens. You look at prostate health, for instance, we've talked about advanced prostate before. My absolute favorite prostate formula. It's one of our top sellers. We get a lot of positive feedback from it. And as we age, the prostate does tend to enlarge. That can cause some issues, both urgency, nighttime, getting up at night to go to the bathroom quite often, some sexual dysfunction. Those are all things that need to be discussed with your healthcare provider. And this is a really nice product. If your medication leads to too much side effects, or you don't want to go down that path initially, then advanced prostate. So this is a great example of the core four. We're going to add this for prostate health. The other thing that I think is a highlight of men's health is over the last few decades, we've gotten pretty good at replacing men's testosterone. And there's a lot of products on the market that claim to naturally increase your testosterone levels. Sometimes they work. For the most part, I don't think they work as well as the actual hormone. So much like when we're working with women on menopause symptoms or premenopause, we're evaluating that, working with their practitioner, and then we're going to deliver the actual hormones. We're not going to deliver an herb unless that's the patient's wish. We're actually going to formulate a compound to deliver the hormones that are waning in production. Same with men. Women was sooner, but now we're pretty good at addressing men's health. Dr. Shippen is my favorite testosterone author. He wrote a book called Testosterone Power. He's one of the first doctors I heard lecture about testosterone. His protocols went from monthly or bi-month, twice a month injections to topical applications. He now is kind of back to the injection world, but he uses 3-4 injections a week so that our testosterone is delivered as close as possible to how our body produces it. Much, much safer, much, much more effective. So using high doses, you get a high dose of testosterone for a while, and then it wanes off. So you have peaks and valleys where you get 3 injections a week, or you're taught to give yourself those injections. You have a much more steady state. The other option, and something that we do a lot of in our compounding lab at Dakota Precision RX Lab, are testosterone creams. These are transdermal creams to deliver that hormone across the skin. These are metered dose pumps, very accurate. We have third-party testing done on these to assure that the dose that we're claiming to deliver is actually the dose we're delivering. What I found is if you're doing something like this, you can use much, much smaller doses because you're going to do it every day. So you don't have to have a big dose. Some guys do it twice a day because they just find that a smaller dose in the morning and a smaller dose at night, I just feel better doing it that way. So again, we're back to that triad of care, working with your physician, the compounding lab personnel, and yourself, determining what's the right dose, what's the right delivery system, and what gives us our best outcomes. That's the epitome of the triad of care. So that's just a few things on men's health. Again, June is Men's Health Month. It's important that we talk about men's health because I don't think we talk about it enough. And I hope this gives you some insight on some things that you can do to better your health.